If you're a woman and you're over 30 and you're wondering if your biological clock is beginning to tick louder than ever, you're not alone. The truth is that there is more to fertility after 30 than fear and frustration. So, in today's video, we are breaking down what every woman needs to know before it becomes too late or becomes too overwhelming. Yes, fertility doesn't vanish the moment you're 30, but a whole lot in your body does begin to change. So if you're here and you're trying to conceive, or you're planning for the future, or you simply want clarity in a world full of misinformation, this is the video you cannot afford to skip. Hey everyone, welcome back to Good Life Diary on YouTube. In today's video, we are breaking down a very important topic that is often not discussed publicly enough: fertility after 30. So if this is something you're very much interested in, just like this video, hit on the subscribe button and we'll get started. Biologically, every woman is born with all the eggs she will ever have. Unlike men that continually make sperm cells all their lives, at birth, every woman is born with about 1 to 2 million egg cells, and they do not make new eggs over time. In fact, there is a continual decline in the quality and quantity of the eggs she has, that by the time the girl enters puberty, she's left with only about 25% of the total number of eggs she was born with. That is about 300,000 this time around. According to the American College of Obstetrics and Gynecology, peak reproductive years is between the late teens and late 20s. That by the time a woman is 30, fertility does begin to decline. Of course, it is super possible to get pregnant in your 30s and beyond. Millions of women do that every year. It simply means that timing and planning becomes much more important, and it is very necessary for you to be aware of all these changes that happens in your body, so that you can take proactive steps in order to optimize and maximize your fertility at this time. What are some of those fertility changes your body may undergo after age 30? This is not a scare tactic. Of course, you can always have your way around them, but first, let me introduce you to them. Number one is ovarian reserve. You know, like I said earlier, every woman is born with all the eggs she will ever have, about 1 to 2 million of them, and by the time the woman attains puberty, only about 300,000 of these eggs is remaining, and it's estimated that a woman will ovulate 400 to 500 times in her lifetime. So by the time she approaches 30, there's already a decline both in the quantity and quality of the eggs she already has, and this decline at first is gradual but accelerates by the time she reaches 35, and this is simply due to changes in the chromosomal composition of her eggs, and these changes in chromosome leads to decrease in ovarian reserve. So what is the second change your body might begin to experience as you approach 30 and beyond? Okay, chances of conception is going to drop. All right, you know, even a healthy woman in her teens or early 20s does not have 100% chance of getting pregnant per month. Of course, you know, there are the fertile days and there are the sieve days. That is days that you can never get pregnant. Okay, so even as a teenager or in your 20s, you have about 25 to 30% chances of getting pregnant per month. So in your 30, the chances drops to 20%, and as you approach 35, it now drops further to 15%, and by the time you are 40, it decreases further to less than 5%. Does it mean you can no longer get pregnant when you have a less than 5% chance of getting pregnant per month? No, it simply means that you might now need some form of reproductive assistance in order to make this happen. Okay, and you should also know that increased maternal age comes with a couple of changes even when you do get pregnant, such as increased miscarriage. It also comes with higher risk pregnancy and maybe increased susceptibility to chromosomal issues, which I don't want to dive into today. There are also other factors that can also impact fertility, such as an underlying medical condition. An example is PCOS, polycystic ovarian syndrome. There are also other factors that can also affect fertility, which include autoimmune disorder, endometriosis, thyroid disorder, amongst others. That's not what we're talking about today, but it is not just your age that impacts your fertility. There are equally lifestyle factors that can impact fertility, which is smoking. Smoking ages the ovaries and causes you to use up your egg supply too early or too quickly. So if you smoke, ask your healthcare provider to help you quit. Another lifestyle factor that may impact fertility is alcohol, excessive alcohol consumption. Heavy drinking is associated with increased risk of ovulation problems. So if you're trying to conceive, quit drinking alcohol. Drinking alcohol can also cause fetal alcoholic syndrome. Why am I adding this here? Because if you're trying to conceive, you might get pregnant without finding out immediately. And if you're into taking alcohol, this could damage your baby both physically and mentally through a condition called fetal alcoholic syndrome. And this condition cannot be cured. All right. So and any small amount of alcohol is capable of causing this problem. So if you're trying to conceive, quit drinking alcohol, quit smoking. Another lifestyle factor that can impact fertility is too much caffeine intake. If you're trying to conceive, limit the quantity or the volume of caffeine you take. About 200 milligrams per day is safe. Do not indulge in excessive drinking of caffeine. It is not good for you. It could prolong your timing for you. Okay, another lifestyle factor that can affect you is increased exposure to toxins. Avoid pesticides, avoid insecticides. They are not good for you if you're trying to conceive. Limit your exposure to them. Okay, another is too much exercise. While moderate to mild exercise is very good for your reproductive health, too much exercise has the ability of disrupting your hormones, your ovulation, and cause you to have ovulation problems. So if you're trying to conceive, do not indulge in heavy exercise. Mild exercises are good for you to help you keep fit and maintain a healthy weight. Another factor is nutrition. You cannot be above 30 and you're planning a family in the future, or you're actively trying to conceive and you're not mindful of what you consume. A diet high in trans fats, additional sugars, and processed foods can negatively affect your fertility. But diets rich in fruits, vegetables, omega-3 fatty acid, fiber can be very good for you and positively impact your fertility. Okay, so avoid some of all these negative feeding habits that are not good for you. Also, it is advised that if you're trying to conceive, you can start folic acid supplementation daily. This is going to help you to reduce neurotubal defects in your baby if you eventually conceive, and it has the ability of also helping boost your fertility somehow. Okay, so when do you need to see a doctor? If you're above 30 and you have tried conceiving for 12 months of regular unprotected intercourse without success, it is the best time to see your doctor. And if you're 35 years and above and you've tried conceiving for 6 months without success, it is that time to see your doctor. So you start on time with your fertility workups and others. Some of the fertility diagnosis your doctor is going to require you to do is your AMH hormone, that's anti-Mullerian hormone. This test for ovarian reserve. It is going to reflect the total number of eggs you have available for conception. Okay, and then the follicle stimulating hormone. This test is best done on the day 2 or day 3 of your cycle. You're also going to be undergoing some ultrasound tests, and you also be undergoing for test for prolactin. Prolactin is one hormone that if it's high, it has the ability of disrupting so many other hormones and causing you to experience fertility problems. I think I'm going to be doing a very detailed video this time around on this hormone prolactin, so that you know the options that are very much available for you. So one very key thing I want you to take away from this video is fertility after 30 is not to scare anyone. It is simply a call to action. Okay, so you know exactly the best thing for you to do. In the next few seconds, I'm going to be telling you the proactive steps you need to take. Peradventure you're not yet ready for a baby, or if you're trying to conceive, so you don't waste your time further. All right, so that brings me to fertility preservation. So to conclude, remember this fertility journey is yours and it is unique to you. Yes, age can bring changes to your body. It can also bring more wisdom, a deeper understanding of oneself and a renewed strength, okay? Understanding your body and the various options you have is the very first step to making a very empowered decision. Do not let anyone pressure you, whether you're trying to conceive at the moment or you're getting ready for the future or you just want to better understand your body. Getting to know the right knowledge is very key. All right, so if you found this video helpful, please like this video, click on subscribe to join this family, and you can share it. It might benefit someone out there who might need it. Until I see you again, remain blessed and be empowered with the right knowledge. I'll see you in my next video.